volunteers in working with our community health promoters. And I am happy that I have been told that it is the vision of St. John to make sure that in every family there is at least one person who understands something about emergency and emergency help. We will work with you to make sure that your vision becomes a reality. At the same time, we are developing a comprehensive architecture for health financing, including emergency medical fund to enhance access to emergency medical care for Kenyans, irrespective of their social status. I applaud St. John for the leadership and commitment to supplement government efforts in provision of emergency and pre-hospital medical service to Kenyans during emergencies and disaster, including when we had COVID-19 pandemic. Your gallant services have saved thousands of lives, and I thank you on behalf of very many grateful people who are beneficiaries of the services offered by St. John. I am also pleased to hear that we share a belief in empowerment from the grassroots. I am pleased to learn that your target to ensure every household in Kenya has an individual who is trained in first aid across the country becomes a reality. This is actually bottom-up in full effect. I acknowledge your contribution to both the emergency medical care policy and the emergency medical care strategy. Your input in making sure that we have a policy framework that ensures that the country is seized with the matter of emergency medical care is a huge contribution that you have made. We intend to build on it as we work on a new legislative framework and policy framework that we are currently developing that is going to take us to enacting 5 different laws, I think, maybe 6. We are working with the county governments so that we can deliver not just on health in general, but also emergency and pre-hospital medical service to the people of Kenya whenever they need it. The St. John ambulance has made strides in strengthening emergency response through community approach. We are taking the same approach in our quest to transform healthcare through a focus on preventive care. We believe community-level management of minor ailments will free up crucial health resources and promote health living. Through government funding, St. John has made significant progress, acquired 6 advanced life support ambulances, which I have witnessed this morning, and established 2 trauma clinics in Emali and Kinungi, purchased training equipment and trained 10,100 first aid responders, including Boda riders, community volunteers, residents of informal settlements, individuals in proximity to black spots and other high-risk areas. Immediately after this meeting, I will be having a meeting with our Boda riders, and I will remind them that I was with you and that I have had the chairman here say that you want to complete the training of the remaining Boda riders, and we will see, working with the Ministry of Transport, how we can make sure that that becomes a reality, and we ensure that we equip our Boda people with skills on emergency medical care and support so that they can become part of the big network that you have built of people who have the skills to attend to Kenyans whenever they are in emergency situations. I am pleased to announce that in continuation of this partnership with government and in response to your request, the government of Kenya is going to allocate 1 acre of land so that you can relocate from your current premise. And I urge Kenyans of goodwill, partners of goodwill from both local and international, to work with the St. John's for them to be able to put up a building befitting the sacrifice and contribution that is being made by St. John. As patron